Evidence showed there was significant variation in practice across England relating to the length of stay and clinical practice for patients undergoing major breast cancer surgery without reconstruction. NHS Improvement, working in partnership with NHS acute trusts across England, formed 13 clinical spread networks who tested the hypothesis. By streamlining the breast pathway, managing patient expectations, and changing clinical practice, found they could reduce unnecessary lengths of stay by 50%. How did we do this? A simple service improvement approach was applied. Step 1. Analysis. Identify your baseline. Step 2. Identify the real root of the problem. Step 3. Visioning. Identify what you are trying to achieve. Step 4. Testing cycles. Test out your ideas. Step 5. Check this is the right solution to address the real problem. Step 6. Evaluation. Evaluate the benefits. What has been the difference? Step 7. Agree the redesign. Step 8. Case for change. Plan how you are doing it. Step 9. Implementation. Implement the idea. Step 10. Evaluate and check sustainability. Step 11. Spread and adoption of strategy. Don't forget to capture the impact and learning throughout your journey. We listened to what people had to say. Patients, carers and clinicians all agreed on what the day case, one-night stay surgical breast pathway should look like. Patients told us, being diagnosed with breast cancer can be a difficult transition to make. One day you're a healthy person, the next you're a patient with cancer. Patients talked about how unnecessary waits, procedures and sitting around in beds increased anxiety. Patients stressed the importance. We want to get back to normal as soon as possible. The new pathway should value our time. Nurses and doctors at King's College Hospital found patients were asking to go home, raising the question, why are we keeping patients in? Patients' expectations and experience of the new pathway were captured. Once the new pathway had been implemented, patients told us through patients' forums, focus groups, diaries, telephone interviews and questionnaires that it's better. Patients have been recorded on video to share their experiences with others on www.improvement.nhs.uk. I was in at 7 a.m, sitting up with tea and biscuits by 11 a.m, home for tea by 3 and out dancing at a party on Saturday night. Just because you're older does not mean to say you have to stay in hospital longer. Highly recommended. Day surgery is better. We asked patients, were you involved as much as you wanted to be in the decisions about your care and treatment? 92% said yes. Did you receive enough information about your care and treatment? 93% said yes. Do you know who to contact if you have a problem at home? 94% said yes. Sharing the learning to accelerate spread. The day case, one-night stay breast pathway is being shared across England so that all the patients can benefit from the evidence-based care, which is medically safe and patients told us that they like. Working in partnership with patients has improved the quality and efficiency of our breast surgical pathway.